Why did it mute the mic? Beautiful. Good evening, everybody. Yes, today is July 14th, 2026. We're well in our, I guess, summertime era or season or whatever. And I welcome you on to my podcast, which is called Medical Talk in Layman's Terms with Nurse Charlene. And you guys know me as Nurse Charlene. That's what I do. Okay. And tonight's topic, I think I'm going to do something fun, something I've never did. And that is a head to toe tour of the human body. And whatever that means, I'm gonna make sure that you know what it means. But yeah, so I'm excited and stuff because this is kind of fun, kind of breaking down the body so that I talk about all parts, and it was just something that I came up with and kind of researched a little bit. You see my little board in the back there, and it's all, it got all the different things, the eye, the brain. I tried to make a spinal cord. I'll tell you when I get to that part. And nerve endings, and you have nerves all over your body, as well as the eye, the ear. That's a pair of lungs for breathing. Everybody has some, one or two, but you start with two, hopefully, and stuff, and then one, you can still breathe and everything. And I have, family members that only have one and they're getting along just fine. And then over here, it's the digestive system, because I'm talking about the total human body from head to toe. So it's not going to be perfect. And I just go through every single sickness there is, because I would be on here forever and a day. It's not even enough time in the world and everything. But we're going to get to the good part. And like I said, it's medical talk in layman's terms with Nurse Charlene. Layman meaning somebody that knows nothing about medical, healthcare, or anything health related can get something out of it. They might not get a full understanding, but it'll be broken down more than they have in the past and everything. So before I get started, I have to do my podcast disclaimer. And once I read that, then I'll go and dive right in. Y'all come on in and everything. Let me put a couple people online. Okay. Just a second. Bear with me, y'all. I see Brittany is already on. Baby girl is on there. Shout out to my baby. She looking and everything. I'm putting her granny on. She'll be ready. Why I got my name in lowercase letters? I don't like that. Okay, that's better. Sorry about that. Here you go, Mom. Just tap on it, but wait till you get in the room. You know I'll be lying. God bless you too. Thank you, Mama. All right, y'all. I'm getting ready to start. So I'm going to start with the podcast disclaimer. Y'all come on in and hype me up so I can get all, into this, and I won't be like, and stuff. But it says, welcome to Medical Talk in Layman's Terms with Nurse Charlene, where health and illness are broken down into simple, easy to understand conversations. That's what we're doing, having a conversation. This podcast is for educational and informational purposes only. While Nurse Charlene is a licensed registered nurse with extensive healthcare experience, the information shared here is not intended to replace professional medical advice, diagnosis, or treatment. Every person is different, okay? What works for one individual may not be right for another. Always consult your doctor, nurse practitioner, or qualified healthcare provider with any questions you may have regarding a medical condition or before making changes to your health, your medications, or even your lifestyle. If you think you may have a medical emergency, call 911, please. Pretty please call 911. Seek immediate medical attention. The views shared on this podcast are based on professional experience and general medical knowledge, presented in layman's terms to help bridge the gap between healthcare and everyday understanding. I'm trying to bridge that gap. By listening to this podcast, you acknowledge and agree that no provider-patient relationship is established. You are responsible for your own healthcare decisions. And remember, your body speaks. Your body's a snitch. Believe it, listen to it, respect it, your body. And when in doubt, check it out with a medical professional. Thank you for tuning in and taking a step towards better understanding of your health. Okay. Thank you guys for coming in. I see Sandra, Miss Sandra, and T is on the line and stuff. Thank you, ladies, for joining in. I'm doing a head-to-toe tour of the human body. This should be interesting. I hope it is. I really worked on this thing. And she says, Miss Sandra said, good evening, Nurse Charlene and Rosie and Britt. Good evening, Miss Sandra and T. Thank you, ladies, for joining. I appreciate you. All right. So what I'm going to do is just go ahead and dive right in. It's enough information that I should, be able to get other people on as they come on in and they sit down with their phones or tablets or computers and everything. So basically, I'm just going to give you the directions of it. It's understanding your body one system at a time. The theme is your body's the snitch. Believe it. It tells you when something isn't right. You just have to learn its language. You got to learn that when your body does something, that it's not just that, and I just take some medicine and it's over and everything. Is this a Mr. or Miss Cook? No idea who you are, but you popped on my feed. Might as well give you a little listen. All right, well, welcome on in. It's live right now from 7 p.m. until I get off and everything. And it's called Medical Talk in Layman's Terms with Nurse Charlene. And you might have got it in your feed from TikTok or something like that and stuff. But I basically just, I'm a registered nurse and I just give information in simple terms and everything. Oh, okay. Mr. Cook and stuff. Welcome on and everything. No problem and stuff. I appreciate you and stuff. So I'm just a nurse, 22 years now as a registered nurse in acute care. And I decided to use some of the knowledge that's in my brain to kind of bridge the gap. Oh, your name is Nicholas on Facebook. Yes. Oh, I see. Why did they do that? Or how do you do that? That is, wow. Okay, I'm gonna have to find out about that and stuff that they inverted your name, your first name and everything. Yes, you need something. Oh yeah, that's because it's this one. There you go. And then you can turn it up. Okay, sorry about that, you guys and stuff, but welcome on in, Nicholas and everything. So I'm just starting and everything. So understanding and everything, you have to learn your language, your body's language, because it's telling on you, it's snitching on you. Okay, today we're taking a journey from head to toe to learn about the amazing systems that keep our bodies alive every second of the day. Think of your body like a well-organized city. Mm-hmm. Oh, yes. Think of your body as a well-organized city. Your brain is City Hall. Okay. Your heart is the water pump or the water system. Your lungs are the air filtration system. Air, lungs, breathing. And your stomach is the food processing plant. It processes the food. It really does that. Your kidneys are the sewage treatment center. When you flush the toilet and stuff, that's what your kidneys are for your body, is the flushing of the toilet, after it dumps out trash or, and everything. And your skin is the security fence. Our skin is on the outside, but it's also other types of skin and the inside. But the one that we want to worry about, or we worry about, is the skin on our body and everything. Oh, okay. It says, I'm on my cousin's phone. It's broke, but on this Maria. Oh, okay. It's all right. Welcome on in, Maria, and stuff. Now I'm starting to get from YouTube, because I stream live from Facebook and YouTube at the same time. So everything you're seeing on Facebook Live, you're seeing also live on YouTube and everything and stuff. Thank you for coming on in there and just let me know. And welcome, Auntie Josie. She said, hello, everyone. She's talking to everybody that's on now. And she says, hope everybody is having a beautiful, blessed evening. And we hope you are having a beautiful, blessed evening. Thank you. You said you couldn't get on. Maria said she couldn't get on Facebook. Oh, no. And stuff. We got to find out about that and stuff. You might have to give me a call later and stuff. But yes, welcome on. I can see you. So definitely just stay where you at. Okay. Yes. And I said that about the skin being the security fence. And then every system has an important job. And when one begins to fail, your body's a snitch. It starts dropping clues. Okay. So that's the whole point. I don't know if you guys can see under my name, Nurse Charlene, it says the CEO of Your Body's a Snitch, Believe It, LLC, because that's exactly what your body is doing and everything. I'm gonna give you some more little clues in a minute. The earlier you recognize those clues that the body drops, the sooner you can get help for them. So then I'm going to go into, so you guys are talking amongst each other, but it's okay. So Josie, Miss Sandra said, wait, you said, I hope everybody's having a blessed day. And then Sandra said, hello, Josie. And then Josie said, I couldn't get on Facebook also, so I have to log in again. What's happening? That's crazy. Remember, I had the little glitching where it was like cut me off and stuff. I don't know what's happening and stuff. They got to get it together though and stuff. I'm gonna find out and get to the bottom of it. That's gonna be my next investigation. And everything that has nothing to do with the body, but we got to deliver the information and everything. But I appreciate you guys and stuff. Y'all let me know if you can hear me, because it has been kind of, a little bit flaky and stuff. So I don't know what's going on. Probably everybody is on, and stuff. It's summer vacation and all of this stuff. So everybody is going to just, tune on in somehow or another. And it might kick some of us out, including me. I hope it doesn't, because I got the Wi-Fi right here behind me. So it better be good and everything. Oh, okay. So I'm going to give you one more thing and stuff. Granny Rosie, my mommy said, God bless you all. Rosetta Granny Allen is watching. In Jesus' name, amen, amen, amen. Amen, Ma. And we love you. All right. So that's one good part. Guess what else is the good part? I said your body is a snitch, believe it, right? Yeah, mine snitched on me. Ooh, what is that, a hospital band? Who went to the hospital? Oh, the nurse. Yeah, I went. Yeah, because I got a human body, like I'm teaching you guys about yours. So you see where the transparency come in at? Even I can get sick. Yeah, I got troubles, in my way and stuff. And I got to cry sometime or whatever, and stuff. But I'm saying this to say that this is real. This is not made up. It's a real thing. I'm a real nurse, a licensed nurse, active duty, and everything and stuff. So when I'm saying this to you guys, I'm just giving you a little bit because, you know, my family, they're privy, you know, they have access, bigger access to me. And so guess what? The first thing I'm gonna tell them is you got to go to your doctor. You got to call 911, or you got to go to the hospital right now and everything. But now I'm putting it out there for everybody so that everybody could get a little piece of this and then take this back to their family, because it may save a loved one, you know, somebody near and dear to them, or a neighbor that they care about or something, you know, and stuff. So getting on here is no joke. It's the real deal. It's authentic. You know, it can be vetted out. It can be, you know, looked at, and you know, you can find out. Okay, so thank you. I'm done with that little, you know, whole thing and stuff. So now getting to the main things, because I'm doing head to toe tour of your body and everything. We're going to start off with the system. So I said that your body is like a city, a well-organized city and stuff. So when I said that, I meant your brain is City Hall. Your heart is the water company or the water pump. Your lungs are the air filtration system, because you need lungs to breathe. And then you got your stomach is the food processing plant. And then you have your kidneys is the sewage treatment center, you know, and stuff for sewage, pee, poop, you know, and all of that stuff. But the pee mainly for kidneys and everything. And then you got your skin is the security fence. Everybody has skin on the outside. It's not just for being pretty or light-skinned or dark-skinned or a different ethnicity and different colors and stuff. It's to protect what's in the inside behind the skin, if that makes sense. Okay. And then now moving on to the major body systems. I broke them down and stuff so that we could get real good in this and stuff. So I'm just kind of run through it, and I'm going to try to talk too fast. But one is the nervous system, or your head. And the definition of the nervous system is your body's communication network. Okay. And it includes in the nervous system, your brain, your spinal cord, and your nerves and everything. So that's what the nervous system can consist of. It sends millions of messages every second telling your body to move. So this is the nervous system tells your body to move, to think, to feel, to remember, to breathe, to blink, even something like blinking, because blinking is protecting your eyes, your eyeballs, you know, and stuff. So that's a big old deal and everything. And without it, nothing works properly. Okay. And so an example of a nervous system disorder, it's so many, but just a quick one that you might have heard of, you know, even, and that would be, one is a stroke. A stroke, the definition is, a stroke happens when the blood flow to part of the brain stops and the brain cells begin dying within minutes. That's what a stroke is. How to spot a stroke, or what are the symptoms, is called the acronym, or, you know, some letters put together that means something. So an acronym is like B FAST, like BEFAST. So let me go ahead and give you this, because this is something good for you. I also taught on strokes just by itself, but this is, I'm doing head to toe. So we starting with the head and stuff, and that is, B is, you know, if you think somebody might be having a stroke or something, B is balance. They will lose their balance. They will, you know, that's the first thing, that you're walking fine and now you're not. You got rubber legs, or you just fall over and just flat out fall. You know, you drop and everything. So that's B, balance. E, because it's B fast. E is eyesight. Eyesight changes, blurry, double vision, just weird things happening with your eyes. So now you can't coordinate, or you fall down and you can't see. It's blurry. You can't clear your eyes and stuff. Something is going down. Okay. And then fast. That would be facial drooping. That would be like a candle. You know how it melts down, the wax goes. So one side of your face or the other, it doesn't matter which side, you should see some type of facial drooping and stuff. So that's happening. And then that was fast. And then arm weakness. That means that, like say you call 911 like you're supposed to because it was giving you clues and stuff. It's like you're supposed to be able to hold your arms out. If you cannot hold your arms out, one will drift. And it depends. That's probably the side the stroke is taking from you and everything, because this is a real stroke happening. Okay. And then that was arm weakness. So fast is facial drooping, arm weakness, speech problems. Somebody else can probably recognize it, but you might not even know that your speech is slurred. But it's almost as if you're drunk, if it's an adult, if you're drunk and you can't get the words out, they're slurring out and, they're weird, and stuff. That's what it is and stuff. And somebody else can spot that on you, but they can spot that on you, or you can spot that on somebody else and help them and everything. And then T for be fast. It's time to call 911. That means they're giving you a 4-hour window. I think it used to be 3.5 hour window. Now it's 4-hour window to get into the hospital if you want to get the treatment set up. Welcome on in, Miss Michelle. She said, hi, Charlene. Welcome on in, my dear. Thanks for joining and taking a little time out your evening schedule to talk to me and everything. And so that was the call 911. And then you tell them that when was your last time normal, because that's crucial. You only got 4 hours from the time you started going bad. So right when you got them wobble legs and you knew that wasn't right, or you fell over somewhere and stuff, you got that time, or that stuff will not come. It will not come back and stuff. You got that time to go into treatment. And treatment is an emergency clot busting medicine, because it's a clot that's plugged up an area that stopped that nutrition and air and nutrients coming to your brain. It stopped it. It needs it constantly. So that's why your heart got to work. That's why your lungs got to work. That's why everything got to work and stuff, like a well-oiled machine, or boom. It's gonna sit you down, whether you like it or not, whether you good or bad, whether you pray or you don't pray. It doesn't matter. When that clot is in the way and stuff, it's getting you, period, and everything. So, Auntie Josie, you said that's what happens to me. My daughter realized my speaking was off. I really didn't know. It's exactly, Auntie Josie was saying. When she had a stroke, but she didn't even know that she was having a stroke and stuff, because it didn't feel like nothing familiar, and she hadn't heard anything from me on the podcast. You know what I'm saying? Or had somebody tell her, explain these things to her. So when she had the stroke, thank God, she was able to realize it. But she was on the phone with her daughter, and that speech was messed up. Every time she was talking, she didn't know that she was doing it, but her daughter recognized it and said, something's wrong. You need to go to the hospital. You need to call 911 right now. And Josie, was it true that you actually got on the bus and went to the hospital? So I know you were probably out of that 4-hour window. There's a good chance you might have been out of that 4-hour window from the time you were last normal. So I don't think you probably got a chance to benefit from that clot buster medicine and stuff. But it's called TPA. Don't worry about what that means. But it's the clot buster, which means it breaks up the clot so that blood can go back to that part of the brain and everything. Oh, you were able to get it then. Okay. So so my auntie that's on here, she was able to get the medicine needed, and now her residual, what they call the residual, what's left over is mild weakness and probably some type of mild things going on and stuff, but nothing bad. Oh, you said, but they gave it to you anyway. So they can make that choice. It depends on the person. And it also depends on, the other thing is, they depends on the one that once they do the scan and everything, because they're going to hit a CT scan immediately and stuff, so that they can see where it's at. Because every time you have one, nobody is immune to having a scar and everything. And also my mother is one that had a stroke, and she was in the doctor's office, and they were like, your mother fainted. I said, yeah, she don't know how to faint, and stuff. And I looked, they had already hooked her up to a blood pressure machine and stuff. And I looked at, and it went higher and higher, and it was going higher. And I was like, she having a stroke. And I asked them when the last time normal. I was a big baby because it's my mommy, but I was able to ask them when the last time they seen her normal, like when she sat down and stuff. So I was able to tell the ambulance that. And so the stroke team was called and met her at the hospital. And they was ready, and stuff. And actually, she benefited from it. Like my auntie Josie and stuff, she benefited from it. But what about the ones that don't benefit because they don't know what it is, and they haven't seen a bridge gapper like me that bridges the gap between, knowing and not knowing, or knowing a little bit, at least a little bit, and everything. That's where that comes from and stuff. But thank you, Josie, for sharing that. And thank you, Rosie Granny Allen, my mommy, for, going ahead and just, speaking their truth, because this is a safe zone. I don't play no games and everything and stuff. But yes, that's a big thing, because they give you clot buster for a stroke. Surgery in some cases they can do for a stroke, depending on what kind of stroke and everything. Then there's also afterwards, after you didn't have the stroke and they did all they can and stuff, then there's physical therapy, rehab, and occupational therapy. One is to kind of strengthen your body, and one is to help you with normal everyday tasks like brushing your teeth, feeding yourself and everything, depending on, how bad your stroke was and what it took from you. So this is a big deal. And then also speech therapy, because if it's on a certain side, if it hits on your left, your right side goes out. I said it wrong. Well, I'm looking at the screen and stuff, but if it stroke hits on your left or is blocked on your left, your right side goes out. If it's blocked on your right side of your brain, then your left side goes out. And then they do different things. Like if you have one where your right side goes out, you can't talk at all and everything. And then if you had the stroke on your left side, where your left side goes out, you can speak through the whole thing, but you're still confused and all the other things. And you still get the facial droop and all of that stuff. And you can be paralyzed and stuff. And it's a big deal and stuff. So that's very important that everybody understand that. And that's just from the nervous system. And that's one of the big things. And then we got number 2, a system. It's called the eyes. See, I got the eyes up there on the board, if you guys can see. And the definition of the eyes: your eyes allow you to see the world by turning light into messages your brain understands. If that makes sense. Light into messages that your brain understands through your eyes. So they're very important. And one of the bad things that can happen to your eyes is a thing called cataracts. That's just an example of one thing that can happen to your eyes that's troublesome. And that's a clouding of the eye's natural lens. So it actually starts getting in your way, like like that morning cold on your eyes, but it stays there. So you got to look between it and stuff. So everything is blurry. You get frustrated. You want to know what's going on. And a lot of people suffer from that and stuff, that type of disorder of the eye and some symptoms of it. It's blurry vision, night driving difficulty, because you got a little curtain trying to come down over your eyes. You got to get it fixed and stuff. But in the meantime, that's what's happening and stuff. Also glare, That means it's that little string, it's like a light, like a Christmas light, but you don't want the Christmas light. You like, I'm cool on the Christmas light. Yeah, that's what it does to your eye. It's like a star, like a Superman or something like that and stuff. But anyway, also colors appear faded, and stuff. They're not as bright and vivid. Like I got bright and vivid colors on. Shout out to Jamaica. But anyway, bright colors and stuff. Treatment for it is surgery. And what they do is they replace that lens that's all cloudy, and because after a while it's going to cover the whole eye, the whole lens, and then you can't see nothing through that. And so you're just about blind. You see shadows and stuff, and it's no fun because it's close to blind and stuff. So you have to get that lens taken out, and they have to put a artificial lens in that does the same thing. And usually people could go on with their vision for years to come. But yeah, you have to go through that first. And that's another special thing and stuff. I wish he would get on, but he didn't get on and stuff. So I can't really talk about it anymore and stuff, because I would need permission or him to go ahead and talk about it and everything. But yes, that's another thing going on and stuff. And then also there's another one for example of a disorder of the eye and stuff, and that would be glaucoma, and that's pressure inside the eye which damages your optic nerve, because you got a nerve inside your eye, and that's how everything is nerve endings everywhere, but you even have a nerve for your eye. And optic means the eye, it's referring to the eye, and it's the optic nerve. And so it's the nerve for your eye. You don't want that damage. That's trouble. And if it start acting up, guess what it is? Blindness, a pure blindness, and everything. So it's something that you gotta, attend to. So another part of the body, because I'm trying to go head to toe. So we got the brain, spinal cord, and nerve endings, nerves all over your body. But then you got also the eyes, and I went to the eyes. And now guess what? Some ears right there. See? So, your ears are important, right? Because you can't hear me if your ears is having trouble or something. And I can't hear you, and everything. So your ears help with hearing and balance. That's where your equilibrium, the reason why you stand upright and don't just flop over every 2 seconds and stuff, is your balance. And that's what happens in your ears and stuff. And when you're off balance, that means something is going on in your ears and stuff. So it's very important. Okay. I'm sorry. I was looking at something. Okay. And so let me see. Symptoms of ear problems is the ear infection. So example of something going wrong with your ears and stuff. Auntie Josie said, I had cataract surgery on my right eye already, and I have to do the left, get the left done in August. Oh gosh. Okay. And stuff. So my Auntie Josie, she's on here, and thank you for speaking your truth. She gives her testimony and stuff, and that is definitely something big. So Auntie Josie, I did want to ask you, when you had that cataract surgery and stuff, has your eye or seeing improved any and stuff? Because that's a big deal and stuff. And then now you're going back to get the other side done, because usually if you have cataract on one side, the other one visiting too. Sometimes it gets done a little bit after, because you got to wait for the healing process, but it's definitely a curtain. And if you don't get it done in time, you'll go blind in that particular eye. Whichever one is bad, it doesn't matter if it's left or right. Whichever one goes bad first and everything. And it's very uncomfortable. It's very scary and everything. So thank you, Auntie Josie. And then we got the ears, and I told you it helps with hearing and balance. And one of the examples of a disorder of the ear would be an ear infection. most babies get that mostly, and that's probably because of the way they're laying and different things like that. But kids can get them and stuff. It's screaming in the ears and constant loud music. Yeah, I've been a fan of loud music and stuff, but I'm just saying, you go to a concert and sit by their big old loudspeaker and you like, I'm in the front row though, and stuff. Yeah, and you're gonna be deaf or your ears gonna be ringing when you leave out the concert if you stay there all day under that speaker and stuff. So symptoms of an ear infection: ear pain, fever, trouble hearing, sometimes even drainage. And it can be blood, but it's mostly the wax draining out the ear. It's kaput. It needs some help. It needs some tending to. You got to tell on it and stuff. So they give you pain medicine, of course, for treatment of an ear infection, and then antibiotics because most ears are bacterial, and so you would need a antibiotic with that and stuff. So that's a big deal. And Auntie Sandra said, so do you get cataract at a certain age? No. Cataract can start whenever, especially if it runs in the family. That's why it's good to tell your doctor as you come across these things, everything and stuff, because you can get it really early and stuff. I was told that I have a little small one, but it hasn't moved and everything. But also, I have parents with the same thing, cataracts and, different things like that, and some worse than the other and everything. So it's definitely, it's not an age thing. It's just up to your eyes and stuff. I can find out exactly some causes of it, but yeah, that's a good question and everything. It's not a certain age and everything. And Auntie Josie said, yes, it got better, but it did take time for me to see better. Okay. And so I bet you it was uncomfortable before you even had the surgery. And you said, but it's great now since I had diabetes, it took a little bit longer. Yes, because the healing process, that's another thing about diabetes that's so horrible, is that the fact that even with mild diabetes or severe, it doesn't really matter and stuff. It just speeds it along. The more severe, the more it speeds on and stuff, speeds along. But definitely the healing process slows down when you have diabetes or a history of that and stuff. So thank you, Josie. Thank you, Sandra. Good questions. They're right on time and right on point. Also, I told you about that. Another thing that happens with the ears is hearing loss. And it's a lot of things that can cause that. It's too many to explain, but I will definitely put them in the comments and everything, that your hearing loss is definitely something that we want to address and stuff, because that means you can't hear or you can barely hear. And then it just goes out altogether. And the symptoms is asking people to repeat themselves. That means that your hearing is getting challenged there, and stuff. You got to tell on it. You can't just say, okay, but I got a Q-tip and I went in there. My ear doctor, ears, nose, and throat doctor told me, don't put nothing bigger than my elbow, smaller than my elbow in my ear. Meaning stay out of there. Go to the doctor and have them dig in there. They know what to do and stuff. You dig in there and you mess around and find out something, that you done punctured your eardrum or that you left a piece of the Q-tip inside your ear. The doctors get really irritated with that and stuff. But that's something. Why did they make Q-tips? Where are they supposed to go? And stuff. So I'm like on both sides of the fence. But yeah, finding out that you could leave a piece in your ear and stuff, that's a problem. And then the wax builds around it and grows around it like a little plant and stuff. And then you got a whole earplug, and stuff. So it's really something bad, and stuff. So definitely good questions and answers, you guys, and testimonies and everything. Another system, that was the ear. Another symptom is your respiratory system, your lungs, the way we breathe. And the definition, the lungs bring oxygen into your body and removes carbon dioxide. You know, you can die off of carbon dioxide. It's a poison, and it slowly but surely can get any one of us at any time. So we have to make sure that we are getting those doctors and letting them get their blood and all of that type of stuff, because it shows them different things, you know, and stuff. And one is CO2. Carbon dioxide is CO2. And it's, you know, it's certain levels, and they give you a range. And even if you don't know how to read your lab results or whatever and stuff, you could just look at the range. And if it looks scary, or it has an H next to your numbers and stuff when you're looking at your labs, or an L next to your number, that means high or low, meaning that you're not normal in that area. And then you need to find out what that is. Is it your potassium that's high or low, or is it your magnesium, or all those different things? Because if they're not balanced, you're not balanced. You got a problem and everything. So with the lungs, one of the number one examples of a problem with your lungs, because I'm gonna give you a problem with everything I call off to you head to toe now and stuff, and that would be your asthma. And so asthma is the airways become swollen and narrow. So you got these big old airways, and you getting that air in. Oh, yes, yes, yes. And then boom, it kink off like a straw that's broken or something. And then you know, you barely can pull it in and stuff. That makes you feel like you're suffocating. So that's why asthma is so important and stuff, because yeah, if you can't get your breath in and stuff, especially the kids, and even if you see a TV show or a movie or something, you see them, they shaking up that little, what is it, albuterol or one of those rescue inhalers, and they're taking a squirt and stuff. It's decreasing the inflammation in the air, so the swelling goes down, so the hole gets bigger to pull your air in and out your lungs. When it's inflamed and stuff, it swells up and it almost shuts them down, you know, and stuff. So it's scary because you're suffocating. So it's very scary and everything. So then it's that sound. It's called wheezing and stuff. And that's because you're not pulling in enough air. If you're pulling in enough air, you don't hear a wheeze because you're getting what you need and everything. The other thing is being short of breath. It starts taking a toll on you, you know, and stuff. It gets scary. And chest tightness, because you can't pull nothing in there to get them lungs going and stuff. So they get real tight and you're scared and stuff. And mostly when the kids have that asthma, that's scary. 911. Don't even put them in your car and stuff and think you're going to get there faster. And then the police after you and all that. No, just call 911. Because they can, I think they even have nebulizer treatments in the, you know, inside the ambulance and stuff. If they don't, they still could get you there faster. They'll shoot that air and put that bag on you and stuff and force the air into you until they get to the hospital and everything. And then the coughing. Coughing is not always because you got a cold or something. Sometimes coughing is because something then swelled up or something is causing trouble and it's making you cough and stuff. And the cough is trying to get some air, you know, and stuff. It's a problem and everything. Another one is for the lungs is pneumonia and stuff. Thank you, Rosie Granny Allen, my mommy. She said, teach my. And Sandra said, Auntie Sandra said, is the lungs connected to the ears, nose, and throat? Everything is connected to everything. But yes, the lungs definitely are connected to the ears, nose, and throat, because where does the air go? In your throat, down your windpipe. You got a food pipe and a windpipe. The food pipe closes, the windpipe opens and takes in that air and stuff. So the ears, nose, and throat are together and everything. And when something is wrong with the nose, like anybody ever had a cold, just a basic cold, you know, but you coughing, you got a little scratchy throat and all of that stuff. And guess what? That little nostril up in there and stuff and get all swollen and it close up. And then you like, you know, trying to get it out this one, and then this one stop up, and then you trying to get it out this one, and you trying to put Vicks up in there to make it you know, open up, but you can't breathe, you know, and stuff. And ain't that uncomfortable? So just imagine a asthma patient It's terrible. It's terrible. But the pneumonia, thanks for asking that. That's cool and stuff. The pneumonia, it's an infection in your lungs. So it's like COVID and stuff. That's why they do a certain test that they test for pneumonia to do the COVID test. They kind of mimic that test and everything, and that's because it tears your lungs up. And anytime you've ever had pneumonia, guess what it does? Like when you have a heart attack, it scars your lungs and kills that part of your heart and stuff. For a heart attack, a brain attack is a stroke, and it kills that part. Wherever the brain attack is, that part of your brain is dead forever. You still function, but just know that that's what happened. And with pneumonia, it scars, just like COVID, it scars your lungs forever. Okay? It scars them forever. It's nothing you can do about that. You can't go in there and get some plastic surgery. Yep, it's going to do what it do and stuff. But am I breathing? Yes. Are you breathing? Yes. And everything. But it is a problem and stuff. So then now we're moving from the lungs to the cardiovascular system, because I told you head to toe tour as much as I can get in and stuff. That's what I'm shooting for. So the cardiovascular system, that's the heart. The heart pumps blood, carrying oxygen and nutrients throughout your body. So guess what? We need a heart. We need our cardiovascular system, which is our heart and artery and vein system and everything. We need that because the arteries and veins, they carry blood throughout the body, but your whole body needs oxygen-rich blood with nutrients and all the good stuff in there, or it's going to be a problem in that area. If they didn't get none and they're not getting fed, you got a problem. You can take Tylenol, you can take Pepto-Bismol, you can take Alka-Seltzer, you can take all of them things, but that's a problem and everything. Thank you, Brittany. She said, love you. You're teaching good, Mom. Teach, Mom. Thank you. I love you, Britt and stuff. So with a heart attack, which is the first thing on a cardiovascular, or your heart. And I think I got the heart over here. Yeah, I hate that. Okay, right. Gosh. Yeah, you see it up there. It's a heart. I didn't make a real live shape of a heart. I just put a big old heart there and stuff. And so the purpose of that is to say that your heart is the one that pumps blood, nutritious blood, to every part of your body. So we need our heart running good. We need it working well. And if not, an example of a disorder of the heart is a heart attack, an attack on your heart, what I was just talking about. And the symptoms is chest pressure, pain to the jaw, it tightens up, arm pain, one arm might just stiffen up, and oh my God, it's very uncomfortable. Sweating, you become nauseous, like you want to throw up, and shortness of breath, all of that happening all at once. And the treatment is call 911. Don't get on the podcast or anything and stuff. Call 911. Don't tell your neighbor. You call 911. Yeah, I'm in trouble. I'll leave the door open so y'all can come on in and get me and stuff. And that's only if you was by yourself. Then they got other treatments like cardiac catheterization. I would go down a rabbit hole trying to get to that and stuff, but cardiac catheterization, that's a type of procedure to help your heart. And then also medications like blood pressure pills, so you don't have the heart attack possibly, and stuff. And lifestyle changes, being able to walk. Yeah, we found out that you don't even have to jog unless you're getting ready for a marathon and stuff. You just walk. And walk everywhere you can, park somewhere purposely farther away so that you can make that walk, and stuff. And that will help you out. Your heart is happy, and everything. And it's sad when they got a whole bunch of plug ups and fatty foods and all of that other stuff. Who's guilty? Okay, I'll start guilty of eating the wrong things and stuff like that And I don't think nobody on here or anywhere in the world hasn't had something happen or a problem from that. Another thing for the cardiovascular system that you would, it would behoove you to learn about would be your high blood pressure, hypertension, whatever you want to call it, that high blood pressure. This is layman term, so I'm high blood pressure and stuff, or hypertension for other people and stuff. And that is the blood pushes too hard against the artery walls, and it's called the heart high blood pressure is called the silent killer, because it's the reason why you have the heart attack. It's the reason why you can have a stroke. It's the reason why you have problems, period. Tell on your heart, because it's going to drop a couple clues, then it's going to turn up on you and you drop, and nobody is around to try to save you and everything. So it's that bad and everything. You can't keep on ignoring it, because it's not going away once you got it. And who needs to make sure that they're making sure that if they do have even a little bit of high blood pressure, that they're going to make sure that they be watching? Well, I don't know about you, but I'm going to go ahead and raise my hand. Me, hospital band, me, I'm just saying, I'm telling, and I'm proud to tell, because I know what I'm talking about. Okay. So treatments for anything cardiovascular and stuff is healthy diets. So we got to get the healthy stuff, and everything that seems like it's healthy is not always healthy. It's the way you do it. It's the way you cook it. It's the what you cook and how much you eat and everything and stuff. Anything in excess is probably going to be where your problems start. And so that's exercise, that's weight loss, that's medication and everything. So that part. And then, okay, I said head to toe. So now we're moving on to the digestive system. And what does it do? That's your gut. You chew stuff through your mouth, or most people, it's other people, it's all types of ways to get food, and it's all types of problems too. But for time's sake and stuff, this is, you put something in your mouth, you chew it up, you swallow it, it goes down a food tube and then that flapper shuts over the food, it goes and dances its way down, and then another flapper opens up, it drops into the stomach churns and breaks down the food the best it can, depending on what you eating. That's why they said lifestyle, diet changes and stuff. That food is sitting in your stomach, it's breaking things down in your stomach and everything, and then it passes it on to the next thing, which is your small intestines. It got a couple partners there and stuff. They pull out nutrients here and there and stuff and put it on the assembly line. You gonna go to here, you gonna go to here, this is for energy, this is for this and all of that stuff, and it works its way on into the large intestines, or the colon, which is also your poop chute, and stuff. It makes its way in there. It takes the last things out of that and stuff. And then the trash that it doesn't need, like, this is just junk. We don't want this in the body and stuff. It tries to put it in that, I called it the poop chute because I'm doing layman's terms and stuff. But that colon, it drops it down into your anal area and rectum and everything. And it comes out as, hopefully, a piece of poop, boo-boo, turd. I don't know, but you know what I'm talking about. So everybody did it and stuff. So that's the game of digestive system. So it breaks food into nutrients your body uses for energy, but it also does that a whole little process. It takes what it needs and it gets on down. And thank you. I like all them hearts. She said, all right, now get on down. You're getting deep now. Yes. And I'm getting on down the body. I've already started at the head. Now I'm down to the digestive system and everything. And one of the biggest examples of something going wrong with your digestive system, it's called GERD, or acid reflux. So it's gastroesophageal reflux disease. Yeah. Did you need to know that? GERD, acid reflux. Okay. And that means that you ate that food, it go down in the food tube, and everything. And it's supposed to dance its way in inside your food tube. Then it's getting ready to drop down into your stomach. But the door that opens up, let the food drop into your stomach, and then it closes. It don't close all the way because we didn't ate too much of the wrong stuff or too much of the stuff, and that's when it come back up in your mouth or something like that. Because guess what? It opens back up. That's why it's called heartburn and stuff like that, because it opens back up and it's right near your heart, because you swallow and it goes down your throat into there. And so guess what? It's now in there with some acid from your stomach. So you don't want the acid from your stomach. You want that to stay down there in the stomach. It's supposed to do stomach things. But it get on up in there and it be dancing around and you be on fire. And it's very uncomfortable. Yes, sir. Yes, ma'am. And stuff. So symptoms that you probably got acid, what is it? GERD or acid reflux disease or something like that is heartburn. Remember I told you acid burns. So why is it in your food tube? No, it's supposed to wait. The food tube's supposed to drop the food down in your stomach. But because that last little flapper, it didn't close, the doorway didn't close, it opened up a little bit, let some of that hot mess in, and it's hot. It's hot because it's acid and stuff that breaks down your food and stuff. But it went on up not in the stomach area, but it went on up in there in your food tube and jacked you up, and you get heartburn, the sour taste because bile comes up too, and then burping. But it ain't just a regular, excuse me. And stuff. No, it's I'm just saying. And then there's chest discomfort because it make you feel like you having a heart attack. You burning. What do I do? It's burning. Yeah, it's burning because it was acid in there and stuff. Sit up straight for one. Get you some cool water and stuff. You might have to start taking a prescription medicine of Pepcid or omeprazole or some of these medicines and stuff, but that's what it's doing. It's getting down, tearing you up, terrorizing you. Another bad thing that can happen with the cardiovascular system. Wait, did I say cardiovascular? I meant the digestive system. I'm sorry. Excuse me, you guys. It happens sometimes. But it's gallstones, and they give you a lot of pain too. They're stones. And guess what? They blocking a pathway that you need, inside your body. So it starts paining you really bad. And you get right upper abdominal. So you look at your stomach and you look at the right side of your stomach. And then right up under, on a man, right up under your chest on the right side, all the way radiating from the front to the back in that area, or on a woman under your breast, on that right side and stuff. That's where it's kind of approximately at and stuff, because we're still doing layman's term. So I can't tell you right upper quad or something like that and stuff. I know other words, but for this sake and this podcast sake, we're saying that and everything. So that's where it's at and stuff. And it's very painful. Then you get nauseated. And then a lot of pain after fatty foods, fried foods. That's why they don't want you to have fried foods, fried chicken, fried steak, fried pork chops, and all of that stuff, because that's all fatty foods. And then the grease that is fried in and all of that stuff. So if you can understand what I'm talking about and how I'm getting to it and stuff, it's a problem. And then the treatment is pain medicine and surgery to possibly remove your gallbladder and everything. So this is serious. Then you got a thing called a liver. So if anybody's ever heard of hepatitis this, hepatitis A, hepatitis whatever and stuff, that's an inflammation of your liver. Hepato is liver. See, I'm teaching you like medical words or little fancy words and stuff. Hepato is liver, and itis is inflammation of your liver. We need our liver, and everything. We need it to be working right, because there's a lot of things that could be wrong with your liver. And one is a thing called fatty liver disease. But before I go any further, the liver filters toxins, trash, It stores nutrients and it helps digest fatty foods. But not if you eating them every day, 3 or 4 times a day, it's not gonna get on down for you, like you wanted to, and stuff. So that's what a fatty liver is and stuff. It's a problem. And so most of the time you don't get the symptoms. It's just sitting in there waiting because it's gonna knock the heck out of you when it get a chance to, roar up on you and stuff. But it may include, or symptoms may include, like fatigue, tireder than tired, extra tired, if that means anything. And then right-sided abdominal discomfort. Now, those are the two things. You don't get much, but you better tell on it. It ain't been hurting, so yeah, you tell, please, and stuff. And the treatment is weight loss, exercise, healthy eating, low-fat diets, and everything, and control of your diabetes. Diabetes is not the end of the world because you can actually reverse it and everything, but you got to get on top of it. You can't just, I already got it, so I just ain't gonna say nothing, or not. Okay, that means you're giving up on you, and stuff. So that's a big deal. Auntie Josie, she said, I have sarcoidosis. I did one, sarcoidosis. Sarcoidosis. I cannot. It's just like that. It's another medicine called vinegar. It's iron and stuff, and I call it vinegar all the time and stuff. It's just certain things that, yeah, they don't want to come out no matter what I do and stuff. But you said, you had it in your liver. So Auntie Josie said she had this this thing in her liver, and which made my liver enlarged. Yes, because it's causing trouble wherever it goes and stuff. It could be on your face. Auntie said, I'd say it. Okay, thank you for being nice about it, but I know I can't. I sat there and I broke it down into syllables so that I could say it right, and I said it right and practice it, and then guess what, I forgot. And got right on the podcast and couldn't pronounce it and stuff. But the whole point of it is, yeah, we getting down to the nitty gritty of this and stuff. So that was your liver and stuff. And then that was your it's another one. When I said hepatitis A, B, and C and stuff, hepatitis is the inflammation of your liver. That's also a dysfunction of your liver because your liver helps you digest fatty foods and stuff, but it's also a part of your digestive system and everything. When I was telling you about all of that stuff that, it goes in your stomach, then it goes in your small intestine and stuff. The liver is right in there delivering its little part to break stuff down also and storing nutrients and all of that stuff that you'll need later. So all of them are team players. So it doesn't matter where it's at and stuff. They all function around each other. And when one go bad, all of them start to go bad. It's just like a car. When one little thing happened, then all of them want to jump on the bandwagon and jump you, and stuff like that. It's just terrible, but it happens. That's what our body does. And so if you have an inflamed liver, you can count on something like your skin will turn yellow as my scarf on my head. You get dark urine, almost Coca-Cola, Lipton tea colored urine. It's because now your body is not getting this certain thing called a bilirubin. Nope, I'm not going into that. But I'm just saying it's all these things that you need, and stuff. Your body is not getting them. So it starts breaking down and it's going to give you, it's dropping clues. You turn yellow. The white of your eye is no longer white. It's yellow. You're glowing like it's a Halloween thing or something. So, all of that happening. And then that fatigue, tired, times 3, 4, 5, 6, and stuff. And that nausea, that's, feeling like you got to throw up, and everything. So all of that stuff is happening. Those are symptoms. The treatment, it depends on what caused it, and stuff. IV drug users, alcohol, all types of stuff can cause it to act up. We need it. But if it acts up, we got to do something about it because it cleans the toxins out of our body. We need something because if we're toxic, then that means it's not coming out. It's staying in there and it's causing trouble. It's going to kill you and stuff. So most of it is rest and then antiviral medications. And then it's also avoiding alcohol. This is the treatment for it. And a medical follow-up. You got to keep on watching this if you still standing. Because some people, they get confused and then they're bed bound and everything else. So it's bad and stuff. So then the urinary system, I just want to try to at least get through the systems and everything. And that is your kidneys. And you usually have two, and stuff. Some people have one, but most of the time you have two. You can even donate one to somebody, and have a kidney transplant and everything. So with that being said, kidneys clean your blood and remove waste through your urine. So poo-poo is trash. Pee-pee is trash. You know what I'm saying? So all these things. So that's what a kidney system does. Your urinary system, which consists of your kidneys and bladder and all of that. And it's a few more other parts to it and everything, but that's the system. And the symptoms that something is happening is severe back pain. Watch out for it. It's not happening for nothing. Something's going on. And it might not be the kidneys. It might be something else. But if it's hurting and you got pain and it's unusual and stuff, go tell. You got to tell. Please. Didn't I show you my hospital bed? Y'all, somebody feel sorry for me. No. And so the treatment, fluids, flushing your system, pain medicine, and lots of fluids because you got to flush the pain medicine out also, and procedures if it's really, really bad. And stuff like a kidney stone and stuff. If it's really, really bad, they might have to break it into little pieces and then let you pee it out, and stuff like that. So it's a big deal and stuff. And urinary tract infections and stuff. And that the symptoms is burning with urination, frequent feeling like you got to pee all the time, like you just finished peeing and it's still that pressure on there and stuff. That's a problem and stuff. It's probably somewhere in there, and it's called the urinary tract, which means the path to the urine system and stuff. Something is not happy. It's inflamed. It's blocked. It got some bacteria or something, and it's crying for you, and stuff. So you got to go get it checked. And it's not going to let you, it give you one or two symptoms. And if you don't go get it checked or check on it or something, or know what to do and stuff like that, you in trouble. It's going to drop you. It will drop you. You get a fever, you get cloudy urine. That's why I said, it's not strange if you pee and then you look at your pee. If you poop and you look at your poop, what if it's blood in it? And you see what I'm saying? So it's not weird or scary and stuff. Look at it. So you can tell it was brown, it was black, and stuff. You know what I'm saying? Tell on it. It was white, it was beige, or something. It was green, tell on it, no matter what. And so, Auntie Josie said, feel better soon. Thank you. But like I said, I'm sitting here. And I was just in a hospital yesterday and stuff. So I'm saying that to say that if you tell on it, because it's telling you, and if you don't go tell on it in time, guess what? Okay, you find out and stuff. So then there's a thing, and but it's a part of your body. So I'm gonna go here. I got to give it to you, and that's your endocrine system. The endocrine system makes hormones that control your growth, your metabolism, your ability to produce children, your mood, and your blood sugar. If your endocrine system is getting jacked up or something like that, it's a problem. And guess what? One of the main problems of your endocrine system, one of the main problems of it is diabetes. Who has diabetes or pre-diabetes? Everybody in the world. I had it, reversed it, might still be skimming up on it and stuff, reverse it and stuff because I know what to do. So, but you know what's scary is once you find out, your conscience will tell you, yeah, you shouldn't eat that cake. You gonna eat the whole thing? The whole cake is, a whole, you gonna eat that whole pie? You know what I'm saying? So it'll tell on you and stuff. So diabetes, I talked about this and taught on it. Maybe I might go back and round it again and stuff like that, which would be your 3 P's: polyuria, polydipsia, and polyphagia. Polyuria is frequent or excessive going to pee. You always got to go pee. Pee, pee, pee. All the bathrooms in Walmart, Target, at the fair, at the beach, where all the bathrooms is, and you got to pee at every single one of them everywhere you go. And then you got polydipsia. That's excessive thirst. I'm thirsty. I drunk water. I still feel thirsty, and stuff. It's a problem. Okay. These are 3 P's of diabetes. And then one is polyphagia. That's just excessive eating. That's pigging out times 10. That means, yeah, you only needed 1 serving. Oh, you're not going to wait. You want seconds. Oh, you want third. Oh, fourths. Okay. Yeah. Nobody else get to eat because you done ate it all. No leftovers, huh, for tomorrow. Yeah. And stuff. So that's where that's coming in at. And then guess what? Sugar is okay to any human body. Sugar in excess is when you have the problem. All of us. Yep, none of us can escape it, even if we know medical stuff. None of us could escape it. And especially there's different kinds of diabetes, but that main one that kind of converts, type 2 diabetes that converts at any time and stuff, that's the main one. Because we do got flaming hot Cheetos. We do got all these different things and that we eat and stuff. And they got the boba teas and all of that stuff. Who said they were healthy? But you got you a big old extra large cup of that, big gulp of Slurpee or something. The Slurpees are delicious, right? Delicious for them diabetes. Yep. So when I say that, symptoms of it, is the 3 P's, a lot of pee, a lot of thirst, and a lot of food and stuff. Then you got your blurry vision, your extra tired, and your slow healing wounds and stuff. We talked about that earlier and stuff. Yes. Auntie Josie says she do. Yeah. And I've been pre-diabetic and then not, and then pre-diabetic and stuff. And so the moral of the story is when you're over your weight, if you start dropping the weight down, the diabetes and the A1C that tests how bad and severe your diabetes is will drop too. So that is why they give you Ozempic and Trulicity and Jardiance and all these different Mounjaro and all those medicines and stuff, because they're trying to make you lose weight. But not lose weight, like, because I want to give me a nice figure or whatever. I want to look like I'm buff again and I got this big old stomach and stuff. No, it's because they need you to lose weight, just period, so you could drop your A1C down. And I've seen it done because my beautiful mother in there and stuff is now, after probably 20 years of battling with diabetes type 2, she's now a 6.2 A1C, which is really, on the lower side. She's almost not diabetic at all and stuff. She got to get down to a 5.6 or something like that and stuff, but she pretty darn close and everything. Oh yes, so that's an improvement, Auntie Josie. She said her A1C yesterday was 6.4. That means you are moving in the right direction, and keep up what you're doing and stuff. Rinse down, if you got to have a soda, nobody said you couldn't. Don't have 5 sodas. Don't have 6 sodas, and stuff. Oh, yeah. Mommy said, well said, help us. Amen. And Brittany said, don't forgetting that we are going to be, people be want to take Wegovy and that people take all those different things. Yes, it's a whole bunch of them. I wasn't able to just call off every single one of them, but that's what they call the GLP-1 injections, or now they're trying to turn them into pills. Yes, thank you, Josie, and stuff. That thank you for sharing and stuff. That's important. But that was about your endocrine system, was diabetes, and then also another one on the endocrine system is the thyroid. And the thyroid is an underactive thyroid and stuff. You need your thyroid. It's in your neck, like where men's Adam apple. They have a thyroid too, but it's like near your Adam's apple. But for women, it's right there too. We don't have an Adam's apple, but it's right there in our neck and everything. And if it start acting up, we gonna find out, because it will give some symptoms. And some of the main ones is extra tired, weight gain, like, a big time weight gain. You start swelling up, feeling cold all the time, dry skin, and constipation, just to name a couple and everything. And then they give you hormone replacement. If it's too low, which usually that's the problem, then it's then you get some replacement. They give you certain things. I don't know if anybody ever heard of levothyroxine and Synthroid and all of those stuff, but that's where that comes in at and stuff. And that's just one of them and stuff. So let me see. It's a whole bunch of systems. I'm just going to give them a happy mention, and then I'm going to go ahead and stop and stuff. So musculoskeletal system, that's for your definition: bones, muscles, joints, tendons, and ligaments that help you move and support your body. And example of it being a problem is arthritis, inflammation of your joint. Itis is inflammation. Arthro is usually referring to a joint where two bones meet. So arthritis is the inflammation of that joint and everything. And it is usually joint pain and all of that, stiffness, swelling, and all of that. And then guess what? Surgery. Another one is called osteoporosis. This is for muscle, skeletal, muscle, and then your skeleton, your bone. So muscle and bone, muscle skeletal system and stuff. So then another one is osteoporosis. It's like a sponge. If you ever had just a good old fashioned sponge, all those little holes, your bones not supposed to look like that. But if you got osteoporosis, your bones look like that. They need to all be filled in as a solid unit. And if that unit is not solid, then that's when you're breakable and everything. And that's the muscle skeletal system. I'm just kind of whizzing through them and stuff because I don't want to keep you guys too late, because I think I've seen a lot of people kind of jump off and stuff. It's okay, because you could come back to the replay and stuff if you have to go somewhere and everything. The only thing is you don't get me live and everything. So we'll see what we could do and stuff. So then there's the skin. It's called the integumentary system. Yeah, you don't want to know that. The skin system and stuff. The definition of the skin, that's your protective barrier. Your skin protects your body from germs, injury, and dehydration while helping regulate your body temperature. So we need to have our skin on. What happens if you don't have no skin on you? Yeah, I don't want to know and stuff. But things that can happen, disorders of that, your skin system, would be pressure ulcer, bed sores, or just anything where you cutting the skin and damaging the skin. And that redness that doesn't fade, open sores, pain, drainage and stuff. And then you got skin cancers that you can have. And they're different things, they pop up on you, and it might be just a little spot, and then it spreads and it starts shape shifting and all of that type of stuff. There's a problem. Houston, we have a problem. That's your skin. Then you have a reproductive system. That's the baby making system or whatever and stuff. Your ability to reproduce the baby. The man has a certain part to play. The woman has a certain part to play. Right about now, the doctors have the main part to play and stuff, because they be playing a God, and stuff and doing that. But if he equip them like that and stuff, then so be it. Who are we to talk and stuff? But the reproductive system is responsible for reproduction and hormone production, testosterone, estrogen, and things like that. An example of reproductive problem is prostate enlargement. When it's enlarged for a man and stuff, they have frequent urination, weak urine stream. It used to come out like, it make a certain sound or certain little music and stuff. When you got an enlarged one, it then closed off and you make a drip, 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 or nothing at all. Call the police. No, call your doctor. Get in and stuff. The treatment is medication and surgery if it's too severe. On a woman, it would be ovarian cyst, and the symptoms of that. So the women have ovaries, men do not. So a problem with the ovary, or that's the reproductive system, is the ovaries have eggs in them. And that's the little eggs that get hatched, by the man, the traditional way with the man, and stuff. And they get hatched and then they grow a baby and stuff. But what if yours got cysts all over it? Then it's beating up that little area and stuff, and it might have to be taken out. Auntie Josie said, I have thyroid. Yes, I heard of those medications. Oh, yes, Synthroid and levothyroxine and stuff. And it's different doses and stuff like that, depending on how severe your thyroid disorder is and stuff. So thank you for sharing that. I appreciate you. I'm gonna have to just bring you over here and you get on with me and stuff. But yes. And so symptoms that a woman has an ovarian cyst is pelvic pain, bloating, and irregular periods, because every time an egg goes and makes its little journey to your uterus, if it doesn't get fertilized, then your uterus sheds that layer of skin and everything, and it comes out as a menstrual cycle and stuff. I used to tell my daughter and stuff, that's your liver room. They clean out the liver room. They cleaning up the liver room. So that's your period and stuff. So you got the what is it? Sanitary napkins is your vacuum cleaner. We got to clean up the living room and stuff each month and stuff. And that's what's happening and stuff. And then, like I said, the symptoms is the pelvic pain, bloating, and the irregular periods. That's a big deal. And then other things is pain meds and surgery if indicated. And then anytime, this is me getting to the end now and stuff. I'll be getting off no later than 8:30 and stuff. But this is very important, even if you have to watch it on playback and stuff. It's head to toe warning signs. Call your healthcare provider or seek emergency care if you have sudden chest pain, difficulty breathing, sudden weakness or numbness, difficulty speaking, loss of vision, severe abdominal pain, blood in the stool or urine, blood in your boo-boo or your pee, high fevers that won't improve, even with a little bit of Motrin or Tylenol, persistent vomiting. That's not good. Maybe one or two, and stuff. But if you keep doing it, something wrong. You're not digesting. Okay. Sudden confusion. That's a problem. That's a problem with a whole bunch of these disorders I went over today. Seizures. That's a problem. Something's making them happen, and everything. And loss of consciousness. You fainted and you don't even know you did it, and stuff. You don't remember and stuff. That's a big deal and stuff. So my take home message is, let me give you a couple snitch. Your body is a snitch quotes. And that would be, pain is your body's alarm clock. Don't keep hitting the snooze button. Okay. Your body whispers before it screams. Listen to the whispers, please. Every symptom tells a story. Learn to read the chapters. That makes sense. Okay. Then we got ignoring symptoms. I like that one. Ignoring symptoms doesn't make them disappear. It only delays the answer. Just because you ignore it or take something for it and it go away that time, and then a few hours it's visiting again and stuff, you didn't do nothing but delay the answer. What is it? And then your body keeps receipts for every healthy and unhealthy choice you make. It can read them off to you. The earlier you listen, the better your chances are of healing. So that's just, it's making it make sense and stuff. Take home message. Your body is made up of many systems that work together like members of a team, Team U. When one system is not functioning properly, it can affect many others. Paying attention to early warning signs, keeping up with preventative care, eating a balanced diet, staying healthy and active, managing stress, getting enough sleep, and taking medications as prescribed are all important steps towards protecting your health. I guarantee you, none of you guys had a good outcome, including me, has ever had a good outcome from ignoring something. Like my foot is hurting, and you ignored it and ignored it and ignored it and stuff. And then when you finally break down or something, you can't walk on it and stuff. And then you go in there and they tell you they got to cut your foot off or, something like that and stuff. Then you'll find out I've been going through all of this and I could have just went on in there and told on it and then we're good and stuff. And you didn't and stuff. I'm guilty of it. I had my ring finger. It was hurting so bad. Oh my God. I couldn't ball my fists up. It was just ridiculous. And I sat there knowing that I teach this to you and stuff. And I sat there and the quality of my life started going down and stuff. And I finally went ahead and went up in there. I got one shot and this was years ago and never had to suffer that again. So guess what? If it run up on me again, I'm catching it before it even starts splintering off because I let it go into full force, and stuff. And then went to the doctor one shot and it was over. And I'm back, using my hand the way it's supposed to be used and stuff. It's ridiculous and stuff. But that's what we got to do. Pay attention. We deserve to have a better quality of life. We deserve to be pain-free, headache-free, and stuff. We can't be stress-free, but we can learn how to deal with the stress and everything. We deserve that and everything, and not having to take something to mask what's going on with us, because then that turns into something called an addiction to cigarettes, addiction to marijuana, addiction, not in the right way, addiction to alcohol, addiction to prescription pills and stuff like that. That's where that comes in at, because you can't deal with it anymore and everything. But if you told, you might have been able to catch it and everything. So the conclusion, okay, because I said 8:30 and stuff. Every heartbeat, every breath, every blink, and every step is a reminder that your body is working hard for you every single day. It constantly sends messages through pain, fatigue, changes in appetite, vision, breathing, skin, or mood. Those messages are not meant to frighten you. They are meant to protect you. Okay? Remember the message behind today's presentation. Your body's a snitch, believe it. It tells you what's wrong long before it gives up. The question is, are you listening to it? Okay. Thank you for joining Medical Talk in Layman's Terms with Nurse Charlene, which is me, where we bridge the gap between healthcare and everyday understanding. One body system, one conversation, and one healthy choice at a time. Stay informed, stay empowered, and stay healthy, you guys. I'm done. And thank you for everybody who stayed on till the very end. I appreciate you. And everybody that had to go and stuff, I appreciate you. But you don't get no Charlene. You're gonna get the Charlene that's already been pre-recorded and stuff. But I thank all of you that came on, some of the new people that came on to the live and stuff, and just made themselves known and stuff. Hopefully, you could come back again and stuff and just, look at it and stuff. Don't forget to watch the replay and everything, and you're good and stuff. I'm just trying to bridge a gap that's been much needed for a long time. I've even talked to a physician in the ER and stuff, and told her what I was doing and stuff. And she was like, oh my God, that was so needed and stuff. And so I'm going to have some lineups of real live doctors that see everybody every day and stuff, that's willing to take some time and come on the podcast, and they will stream live with me, and we'll do just general information and everything. So just watch out, because this thing is not going down. It's going all the way up. All right. Thank you guys, and y'all take care. And I appreciate you, every single one, all the participants and everybody who just joined in and just watched. It's okay. All right. Thank you guys. Bye-bye.